Hello and welcome to the Health Show. My name is DiBella and I'm your host. Like every week, we have interesting doctors that come on and with a wealth of information. Now, the doctor we have today, his name is Dr. Julian Whitaker, and he's another doctor that was handpicked by me and went into my book, 60 Doctors Talk About the Cure and Prevention of Cancer. So now we have a lot to cover. We're going to be talking about heart disease. We're going to be talking about diabetes. So without wasting any more time, welcome Dr. Whitaker. How are you?
I'm just fine. Thanks for having me on your show.
You're quite welcome. Okay, so now Dr. Whitaker is America's alternative medicine doctor. He is known all over the world. The author of 13 best-selling health books and the foundation of the Whitaker Wellness Institute in Newport Beach, California, where thousands have been successfully treated since 1979. So, Dr. Whitaker, can you tell our viewers a little bit about what your credentials are?
Sure. First, we're at Newport Beach, California, not Long Beach.
Oh, I'm sorry.
Minor thing. Yeah,
okay.
Newport Beach. And I graduated from medical school in 1970. Then I started an internship at Emory University Hospital, and then I went into an orthopedic surgery residency. I did not like the residency or the thought of the orthopedic surgery as a profession. So I dropped out of the orthopedic surgery and went to work with a fellow by the name of Wilbur Currier. He was an alternative doc. And while I was working with him in Pasadena, he gave me information on Nathan Pritikin, which I imagine you've heard of. Nathan Pritikin with the Pritikin Institute, the very low-fat diet. I read about that, and I said, I'm going to go see him. And I went up, and I joined his group for about 7 months. And I learned a lot about how to use diet and exercise. Basically, he gave them rabbit food and told them to walk around the hotel all the time. Mm-hmm. And I saw, for the first time in my medical training, I saw people get well. They actually got well. It wasn't they get better, they got well. They came off their cholesterol drugs, they came off the hypertensive drugs, their heart improved, their weight went down, the diabetes went away, they just got well. So I said, that's what I want to do. So I opened Whitaker Wellness, and based upon the fact that when you can bring people in with these serious problems, and you can educate them over a period of time, they have a tool to walk away completely from diabetes, the type 2, heart disease, angina, so they walk away from the serious diseases that we're suffering with and stay away from them. So I've been doing that for 35 years.
Mm-hmm. Now,
we've had thousands of patients come through. I have 7 doctors on our staff.
Mm-hmm. Now, when you first started, did you start to give statin drugs?
Did I what?
When you first started, did you start to give statin drugs to lower cholesterol?
Did I use statins?
Yeah, when you first started your practice, did you use statin drugs when you first started?
No, I never did.
Oh,
when I first started, there weren't any statin drugs.
Oh, okay.
You know, they came later, but I've never used statin drugs.
Oh, okay.
If people come in taking statin drugs, I stop them instantly. Other physicians do the same thing, basically because we're trying to do the same thing. But we stop the statins, and for very good reason. They make patients worse. Mm-hmm. It's horrible what statins do. You see, statins block an enzyme system in the liver, HMG-CoA reductase. Now, that enzyme system, which statins block, is the enzyme system that's used by the liver and other organs to manufacture cholesterol. So the statins will lower the cholesterol level by blocking its manufacture. Well, that same enzyme system is used to manufacture coenzyme Q10. Now, coenzyme Q10 is absolutely vital for energy production and energy utilization. So just as the cholesterol level drops, so does the coenzyme Q10 level drop. And I see people coming in that can hardly walk because they're taking the statin drug. Instantly, we stop the statins.
You know, years ago, I had high cholesterol also. And I was fortunate to have a friend that was a thoracic surgeon. And he said, you know what, go on an aspirin a day. I've done that for maybe 40 years. Never had a problem with my cholesterol. I had high triglycerides, high cholesterol. But can you take us back, way back when, what the numbers were? Today they say 200. What were the numbers back then when you first started that was acceptable?
You know, they've changed so much, and what they're doing to support the profitability of statin drugs. Every time they meet, they lower the cholesterol level for which you start statin drugs. It used to be that people with cholesterol levels of 245 could or could not get any treatment. Now, they're recommending statin drugs for people with cholesterol levels below 200, with not a shred of evidence that it's beneficial. It may lower the cholesterol level, but it doesn't prevent the heart disease that everybody's afraid of. So I think the dropping cholesterol is more a business ploy than it is a health directive.
Okay. Now, triglycerides is the same thing, right? In other words?
Triglycerides are very, they go up and down and they're all over the place. So I had a patient one time that came in because he's, day after a big beer fest or something like that. And he had triglyceride levels of 1,300. So he had mentioned what his diet was and this type of thing, and particularly recently. So I said, look, stop that stuff. Just drink a lot of water and come on back in 3 days and we'll see what your triglyceride level is. It dropped from over 1,000 to under 100 in just a few days. So triglycerides are not like cholesterol. Cholesterol ranges, say, from 150 to 290. Triglycerides range from 80 to 3,000. So within that range, you can find people with high triglycerides. Secondly, high triglycerides are not like cholesterol in that they don't carry this burden of enhancing disease nearly to the effect that we believe cholesterol does. I don't think cholesterol is nearly as dangerous as other docs, but I know triglycerides certainly are.
Well, our body does need cholesterol in it for your brain and different things. Isn't that right? I mean...
Oh, absolutely. It makes cholesterol.
Right.
The body does not waste energy making things.
Right. Okay. Can you talk a little bit about what your approach is today on heart disease?
Oh, yeah. Well, there's two areas of discussion for heart disease. Number one, the way it's treated, and number two, the way it should be treated. The way it's treated is that this explosive use of surgery, bypass, angioplasty, it's just gone crazy. And that all started back in the 60s. They did some studies actually right in the 60s with bypass. They got about 390 people together, all with some anginal pain, and they split them into two groups. One group had the bypass, one group didn't. At the end of the 3 to 4 year study, the death rate in the bypass group per year was like 2.1% out of 100. The death rate in the non-bypass group was 2.3%, virtually identical. That was a Veterans Administration hospital study. They did another study because the docs were very upset that the Veterans Hospital study did not confirm their beliefs and what they were telling patients. They're telling patients, you know, you could die any minute unless we do this bypass. They still do. The patients that go in for bypass would not go in for bypass if they just knew the results of the surgery. So the next study was a CAS study, coronary artery surgery study. These are nationwide, highly sophisticated studies. So again, about 400 patients, 200 of them have the bypass, 200 of them don't, and they have equal degree of disease, and they flip a coin on each one. Now it was even worse. Those that had the bypass had a death rate of about about the same, and those who didn't, exactly the same thing. So scientifically, bypass surgery should not be allowed, because when you study it and you're looking for the endpoint of heart disease, of heart attack or death, there's literally no difference. And not only is there no difference, but there is no possibility that bypass surgery could improve the death rate. Because if you're having a death rate of less than 3% a year, and you're expecting bypass to help you, then what you've got is that you'll have to operate on 100 people to prevent 3 heart attacks. Well, the heart attack rate of Medicare patients on bypass, 12%, is 4 times the death rate of the expected death rate on heart. So there's no reason for bypass other than the business of cardiovascular surgery.
Mm-hmm. Okay, I had a friend of mine, unfortunately, just died. He was in his 40s, and he just took his son to school, and he was on his way home, and in the car, I guess he got a pain in his chest, and died in his 40s. Now, is it more, I've heard this years ago, is it more severe when you're younger than when you're older?
No.
It's not?
No, that's a very rare, listen, it's a common case because a lot of people die from heart disease. It's also a common case because when it gets younger, it's a lot of publicity. But the way that you would prevent that has nothing to do with drugs and certainly has nothing to do with surgery. The way you prevent that is you get on an exercise program, you eat a high complex carbohydrate diet, you take a bunch of vitamins, you take some coenzyme Q10, you get on a program that we institute here at Whitaker Wellness. That's your best bet. Mm-hmm. Because when you do that, now that can be summarized by the cardiovascular surgeon. He died at age 40. We should have cathed him when he was 38. I mean, it's nonsense. Absolute nonsense.
Mm-hmm. Could you tell our viewers, in your opinion, what a person should eat that has heart disease and what a person shouldn't eat?
Okay. The diet for heart disease should be high complex carbohydrate foods. It also should be protein foods. You just want to eliminate a lot of the fatty foods, okay? And the other thing is, it's not just diet, even though it is just diet in Japan. They don't have any heart disease over there to speak of. It's coming in there since they're bringing in more fat. But it's just high carbohydrates, vegetables, and low fat. That's your diet that you eat. But you should also have an exercise program. Here at Whitaker Wellness, particularly if patients are overweight, and we see a lot of overweight diabetics, we put them on that kind of diet, but we tell them not to eat breakfast. And I know breakfast is the most important meal of the day and all that kind of nonsense, but if they don't eat breakfast, they're still burning fat because the body has lost the carbohydrates and is now burning fat as a primary fuel. And you want the body burning fat. You want it burning, not adding. So they don't eat breakfast, and I tell them to go for a 40-minute walk. So they go for a 40-minute walk. We do this a lot with diabetics. We have them take the finger stick sugar before and after the walk. It always goes down. But if they do that, then the fat is increased in its burning, and the health is improved dramatically because they're burning the fat and they're walking. Then they'll eat a regular, a healthy lunch and a healthy dinner, and then start the process over the next day.
What do you think about eating meats?
I think meat in moderate intakes is fine. I didn't think that when I was with Pritikin, because I learned and I saw people get much better when they just cut meat out completely. But I don't think meat needs to be eliminated completely. You don't want to eat meat where you're increasing your fat and also increasing your weight, but by the fat. But in general, I think meat can and should be, or could be, a part of a very healthy diet. It's just a matter of quantity.
Can we talk a little bit now about emotions and what role that plays in health, heart health?
I'm not sure what you're talking about.
In other words, stress, depression, anxiety, and all of that.
Oh, emotions.
Yeah.
Oh, you know what? I thought you said emulsion.
You're the second person that said that.
Really?
Well, I must be coming across
my ears
wrong.
are good.
Emotions. I'm a hypnotherapist, and I've been working with people with life-threatening illness, such as cancer and heart disease, for over 25 years. And I've seen a big, big improvement in people when they learn how to relax their body and deal with anger, stress, depression, and all of that.
Absolutely. And I've been a big proponent of that. When we have groups of people that come into Whitaker Wellness, and I used to, but I don't anymore. I used to have them all lie down on the floor with a pillow, and I'd sit on a stool in the front, and I'd lead them in a progressive relaxation program for about 15 to 20 minutes. And they all loved it. And it reduced their stress, etc. One thing that I use, if you're talking about the discomfort of dysphoria, you see, emotional ups and downs that are unpleasant, I call, and everybody else calls too, is dysphoria. Anger outbursts, anxiety, temper tantrums, depression. Basically, it's depression with anxiety. And it can ruin your life. Those methods help. But the one thing that I found to be the most successful antidote to dysphoria, and dysphoria includes all of those, because dysphoria is horrible for people to live with, but not only that, it's not healthy. And that is the prescription drug Dilantin. Now, Jack Dreyfus, back in the 60s, was having dysphoria. He's a very successful guy. He was seeing a psychiatrist at that time, and it was just talk therapy. Fortunately, it was just the talk therapy, and now they don't have talk therapy. They put him on drugs. So he asked his doc, he thought something was happening with the electricity in his brain. And so his doc said, well, we use Dilantin for seizures. Maybe we give that a try. A stroke of luck that was uncalled for, but very valuable. Jack Dreyfus has written several books on this, studied it, wrote about it. If you have someone that has dysphoria and you have them write down, how do I feel? And then the next paragraph is, what are my concerns? Just that. Then they take 100 milligram Dilantin. It's been around for 40 years, safe. And then an hour after that, they write down, how do I feel? What are my concerns? you will see unbelievable changes.
Mm-hmm.
And so we use Dilantin regularly. We take the test, we give them the Dilantin. You know, there was a woman here, or a guy here with Tourette syndrome. You heard Tourette syndrome?
Yes. Mm-hmm.
And he was coming out with blue streak language that she could not understand. You couldn't believe. He was still married, but that was hanging by a thread. And he was walking down the sidewalk, and he was just blue streaking. And there were people, gardeners, working in the trees and on the bushes. When he walked past, they put everything in the truck and left. And we were going to send him home. I was going to send him home. But I said, okay, I'm going to try Dilantin. I gave him Dilantin, and it stopped instantly, the Tourette syndrome. This is on health, but this is a very important issue. So I want to point out that what Dilantin does is it slightly prolongs the repolarization variant in the nervous impulses that travel from the brain to everywhere else. Mm-hmm. That slight enhancement of time cuts off a lot of things that are cycling. You know, there's a song in a movie that John Travolta was in, say, everybody talking at me. I can't hear a word they're saying, only the echoes of my mind. That was John Voight. He's a patient of mine. And he was in the audience when I sang that, and I didn't even remember that it was part of his movie, where I think he won an Academy Award for that. But the point is, that's what Dilantin does, is it takes out all of that dysphoria. Now, stress marriage, stress work, you know, you need work on those things. But the most valuable thing in my hands for helping dysphoria is that simple, inexpensive prescription drug.
Mm-hmm. Okay. Now, could we go back a little bit with cholesterol? There's a lot of people that really don't know about HDLs and LDLs. A lot of people that they know, everybody knows that HDLs are the good cholesterol, but a lot of people don't know that LDLs also, they are good LDLs in the LDL also. So can you talk a little bit about the HDL and the LDLs?
Well, yes, the cholesterol has, the fats are in three fractions. HDL is a very small cholesterol molecule. That's the good cholesterol. That transports cholesterol out of the tissues and transports it up to be metabolized. You want to increase your HDL. LDL is the fatty cholesterol. That's the dangerous kind. And then there's triglycerides. Triglycerides are not that dangerous, not as dangerous as LDL, but they are part of that overall fatty matrix that needs to be addressed. So you want to have high HDL, low LDL, and low triglycerides. It's not that hard to do. If you take some niacin, just vitamin B3, it will dramatically lower the LDL and the triglycerides. It just knocks the legs out of it. And it increases HDL. So not people on niacin increase HDL. Now the docs don't use this because nobody makes a dime on it. Mm-hmm. You know, they want them to take, you know, the statin drugs and all these other kind of nonsense drugs that do harm, but they won't use the niacin. There was a guy, I think he's at the Mayo Clinic, where he did a study on niacin and found that it was safer and more effective than statin drugs or other prescription drugs to lower the cholesterol level and elevate the HDL, and published it in JAMA, one of the medical journals, and he got scorned throughout the profession, not because he was wrong, but because he was treading on what they wanted to do. So I don't know any doctors that are giving niacin. I do occasionally, you know, Patients respond, react to it because it causes a flush, histamine release. But niacin is far superior at changing those cholesterol levels. Now, what you can also do is the diet and exercise. People who exercise elevate their HDL. People who exercise lower the LDL. People who exercise dramatically lower the triglyceride level. So exercise is a drug with very good benefits.
Right. Now, could you tell our viewers, there is a difference when you're, say, 40 to 50 to 70 to 60 to 80 in cholesterol numbers. Is that correct? In other words, they are a little bit more elevated as you get older.
Okay. All right.
Is that true?
Probably.
Yeah, okay.
I haven't really studied that. I look upon cholesterol, unless it's really high, as something that you can easily bring down as a health marker that is not a good health marker, and that you can do something about it. But I don't look upon it with near the kind of lustfulness as traditional doctors do. I don't think it's nearly as important. Mm-hmm. Everybody's got this cholesterol mania. Mm-hmm. However, the death rate from heart disease has dropped in the last 35 years. Mm-hmm. The death rate from cancer is now number one. It used to be a distant second to heart disease. Now the death rate from cancer is higher than heart disease. So I don't think that the cholesterol level is as big a problem as those who want to push statin drugs say that it is.
Right. Now, if your mother or father or brother or sister had a heart attack, do you feel that you might be at risk also?
Well, the family history of heart disease is pretty significant in certain families. And when you find that family has these high LDL cholesterol levels and high triglycerides, then you're looking at something that is significant. But a family history does not warrant a very aggressive traditional treatment. It warrants healthy treatment, diet, exercise. So if you have a family history of heart disease, then you need to exercise, eat the right diet, and monitor these things, and you'll watch them go down. So you can control all of the aspects that are controllable to prevent heart disease, family history or not.
Now I'd like to talk a little bit about diabetes. Believe it or not, when you look around, there's so many people that are overweight and obese. Would you say that that's the number one cause of diabetes?
It is the absolute cause of type 2 diabetes.
Right.
Some people call it diabesity, okay? And type 2 diabetes is 90% of people who are diagnosed as diabetic. And since the people are getting bigger and weight is increasing, we're having more type 2 diabetes. So type 2 diabetes is a real scourge. And type 2 diabetes leads to amputation. It leads to loss of the nerves. It's a horrible disease. But of all of the diabetic conditions, that's the easiest to treat. All you have to do is get someone to stay on an exercise program and reduce their calorie intake. And now, those are not easy to do. Mm-hmm. They're not easy to do. But I have my patients, I'll share this with your viewers, I give them what I call instant discipline. Would you like some instant discipline?
Sure.
All right, let's say exercise. Let's say you think you should walk 30 minutes 3 times a week. Okay? Just that. Make it easy. Make it so you can do it. And then you make a contract with yourself and you have it witnessed. And you say, I am going to walk 30 minutes 3 times every 7 days. And if I finish the 7 days and I haven't walked my 30 minutes 3 times, I am going to send $200 to the political party that I least like. So if you're a Republican, you send it to the Democrats. If you're a Democrat, you send it to the Republicans. You have no idea how much discipline that gives you. Because number one, you've got 7 days to work 3. You see? So you can finish it in 4 days and be home scot-free. But you're exercising. The important thing is you are exercising. And you're exercising because you have a negative incentive to exercise. Mm-hmm. Does that make sense?
Yes, it does.
It works a lot. It works very well. I've been using it for years. And
diet and nutrition have a lot to do also with becoming free of diabetes also, right?
Well, what helps you with becoming free of diabetes type 2 is weight loss. Now, that is a problem because the treatment of type 2, in general, in my opinion, and actually it's been shown, make the diabetic worse. Because what they'll treat them with is the glyburide or the metformin. Those are the pills. Then they'll put them on, they'll say, well, we're not getting your blood sugar down low enough, so we're going to give you insulin. Now, these are type 2. These people are already overweight. So now they're taking the glyburide and the metformin. Those drugs were shown back in the 60s and 70s to increase death rate. Particularly the glyburide was shown to increase death rate 200%. So it's a horrible drug, and patients don't know its danger. So we stop those 2 drugs when we see them. And we put them on fiber, diet, and exercise, and then we watch their weight come down. But the worst thing that can happen, and all the diabetologists do this, they think, can you understand me? Can you hear me?
Yes, I can.
Okay. They think that bringing the blood sugar down is the most important thing you can do. Well, if the guy has got type 2 diabetes and he's 40 pounds overweight, you're not going to bring his blood sugar down to normal. So what they do when the drugs don't work, they add insulin. The worst thing in the world to do for an overweight type 2 diabetic. Because when you add insulin to a type 2 diabetic, he is going to gain weight. It doesn't matter how much weight he has now, he will gain. I had a patient come in, been treated with insulin and gradually increasing doses for 10 years. And he had gained 100 pounds over that 10-year period. We stopped his insulin that day. It's nonsense to give a very heavy person insulin, because that's going to make him more obese, and it's not going to help the problem, it's going to make it worse. So I took his insulin and his bottles and dropped them in the trash can and made a little noise with it, and to emphasize the need for him to stop insulin when he's 100 pounds overweight. And he lost that 100 pounds in 2.5 years and never went back on, at least while I was following him, never went back on a diabetic drug of any kind. Mm-hmm. And that's not unusual. That's routine. That's people with type 2 diabetes could do this at home. You know, the real problem with the type 2 diabetics is they have ulcers on their legs and all over the place, because and then they get involved in wound care. So they go to wound care, and then the wound care physician has scissors and a pair of tweezers. Bad sign. Scissors, pair of tweezers, and they cutting off dead skin. Okay, and it always bleeds. Well, what has he done? He's made the wound bigger. Whenever you manipulate the tissue, the external, the epithelium, and it bleeds, that's more wound. So what we do is that we wrap those wounds. What do you think we wrap them in?
I have no idea.
Sugar.
Is that right?
Yes, right. There's a doctor in Mississippi that back in the 60s, his nurse, they had a orthopedist, he was orthopedic. So in the traction room, where people were lying up in traction with hip fractures and all that, they were developing decubitus, stasis decubiti, big bed sores. You know, bed sores kill over 100,000 people a year.
Mm-hmm. Oh, I didn't know that.
You know, it always amazes me that a Malaysian airplane, 209 people died. Okay, more people died from bed sores per day than died in that airplane. But it's never front page news because it's gradual. So his nurse came in and said, listen, my father was a farmer. I grew up on a farm and we had cattle. And when the cows got wrapped up in barbed wire, he'd get in the Jeep and he'd have a 10-gallon pail of sugar with a spatula. And he'd go see the cow. He would cut the cow out of the barbed wire and throw sugar all over the cow and go back and do that, every 2 or 3 days. They always heal. I'm going to go into the traction room. I'm going to take off whatever wound care you got on there, and I'm going to wrap all the wounds with sugar. Mm-hmm. So she went back in there and took the wounds off and wrapped them in sugar. When they went there to see him Monday, there was no odor in the entire place. And they all healed. So he began using that as wound care for anything. His published results, I think it's 6,000 wounds that heal without scarring to speak of. In other words, if you've got a big wound there, you're going to have different colored skin over it. Without scarring, they just heal. And then he would take pictures of them. I've got 2,000 slides of wounds that if you wrap them in sugar, they will heal. Mm-hmm. And we've been doing that for 20 years. Mm-hmm. And the wound care guys, they give IV antibiotics, oral antibiotics, they put betadine on the wounds and all this kind of stuff. And all they need is to wrap it in sugar. Now, here's the question. Everybody says, how in the world does that work? Well, when sugar dissolves in the body fluids of an open wound, it creates a hyperosmotic environment. It's like putting a goldfish into the Great Salt Lake. It immediately kills all of the bacteria in the wound. The Egyptians were doing this with honey and goose grease 5,000 years ago. So it's not a new therapy. So it can kill the bacteria and stimulate healing. And I'm talking about rapid healing. Mm-hmm. And it cuts down on any kind of skin graft that you need. It cuts down on patient time, and you don't have to have someone cutting you up, trying to heal you. And it's crazy what these wound care guys do. They're cutting people up trying to heal the wound. Doesn't make any sense. Mm-hmm. Because if you cover that wound, how would you treat your son who fell down and had a big scab on his knee? Would you go in with scissors and tweezers and pull the scab off every day? Makes no sense. So we do it with sugar. We wrap it up for a week, look at it a week later, and it's much better, if not healed.
Well, that's something new I haven't heard of. And I'm sure a lot of our viewers haven't heard of that either. One thing through the years that I have seen is a lot of people that have cancer also have diabetes. Is there any connection with that? Do you know?
I don't know of any connection. And actually, I haven't seen that. Uh-huh. And I see a lot of diabetics. But I haven't seen them coming in with diabetes and cancer. See, diabetes is so prevalent. Cancer is too. But cancer does not pick diabetic individuals, at least not as far as my experience is concerned. Mm-hmm. And I probably would have seen it because we see a lot of obese diabetics, and we don't see much cancer. We're pretty busy with their diabetic concerns, their ulcers in the legs, their weight, but we don't see them turn into cancer much.
Right.
It may have, I don't know, and I haven't read about diabetes being a cancer risk factor.
Right. Now, could you talk a little bit about the equipment that you use, the hyperbaric chamber, and what does that do for a person with heart problems?
Excuse me?
Hyperbaric chamber. What does that do?
I can talk about hyperbaric oxygen and what else?
Yes.
Okay, we're probably one of the biggest hyperbaric oxygen centers in the country. We've been doing hyperbaric oxygen for 20 years. We've got 7 hyperbaric chambers. We can treat close to 100 people a day. So we vary with the number of people we treat, but we treat a lot of people with hyperbaric oxygen. And it's one of our most powerful therapies for wounds. We had a young girl, this was almost 15 years ago, had a big flash burn in her face, went to the hospital. She was put in intensive care, ICU, for 2 or 3 days. And then they bandaged her up and sent her home. The first physicians that evaluated her were plastic surgeons. They were already planning on what they were going to do with the reconstruction of her face. She was this girl was very young and very attractive, and she was a friend of one of our daughters. And we immediately put her in a hyperbaric chamber. And we gave her 2 treatments a day for a couple of weeks. And so she'd go back to her doctor, and the doctor would say, "What are you doing? Everything's healing. There's no scar." She says, "I'm doing hyperbaric oxygen." So this is true. It's kind of macabre, but interesting. The doc said, "Well, we didn't tell you to do hyperbaric oxygen." And I had warned her that the docs are going to, stand on their head and spit wooden nickels. So she said, "I know." And so then he said this, and this was interesting. He'd seen this patient with dramatic improvement in healing, that he'd never seen before. And he didn't order the hyperbaric. And so he said, "Well, we don't want you to do it."
Why is that?
I don't know him, and I wasn't going to ask him, and I was not surprised. All right? Doctors have a way, they don't like to see anybody go outside of their environment. So anyway, she got better. And what's the value in an attractive lady that had a flash burn all over her face, up into her nose, down into the upper part of her trachea? What's the value of her not being scarred the rest of her life, which is exactly what she's going to have, because they're already planning surgical procedures. And then to see that kind of result and not even be interested in it. So we use hyperbaric on wounds all the time, but the wounds that we have with the diabetics that are real open, they're best treated with sugar. However, we put them in the chamber too. Sugar dressing, chamber. We're pretty good at wound healing. Real good at it.
There's another piece of equipment that I've seen online that you have. You lay in it, it's like a table, and like you move, back and forth, like your whole body moves. Could you explain that?
You're probably talking about EECP.
Okay.
Does that ring a bell?
I think so, yes.
Okay. Interesting. EECP is a therapy where we put patients in a body stocking from the ankles up to their waist. And we hook them up to the EKG. And it's pneumatic, it's air. So this body stocking is filled with air. And then when the heart beats, the body stocking contracts with an upward flow of the contraction. So it's pushing blood upward into the body from the legs. And so this additional pulse it's enhanced counter pulsation, EECP, enhanced counter pulsation. And that helps with all kinds of heart disease. And this is the interesting, I've had 100 of these therapies myself. So when we're measuring them, we first the symptoms get better, the angina is ameliorated. So, but when we're measuring the pulsing, we look at the EKG is like this, and then the pulse is like that. So this and that. It goes just past the T wave. It just jumps up. All right. I can demonstrate the changes in these pressure measurements in the arteries and make the claim that EECP makes the arteries younger. Now, the reason I can say that is because flexibility of the arteries is a sign of youth. You know, you can feel the arteries in a 15-year-old, and it's just, you know, it's like the arteries are not stiff at all. And as they get older, and this is not cholesterol, as they get older, the arteries stiffen. With EECP, this accentuated beat tends to go up the more you take. You have 35, 40 ECPs, and all of a sudden, your arteries, you know, are going up 200% on expressing the pulsation of that. Well, that's okay, but it does dramatically improve the conditions of cardiovascular disease. You know, whether it's the heart or in the legs, it's a very effective and predictably beneficial treatment. And it's done all over the place. I bought my machines from China. That's where they did the research on it. And then we've now got the American made, because there's a lot of EECP treatment centers. It's in some hospitals, but not very many. Because why? Well, it's going to take the place of all that surgical stuff they do. You know, EECP will produce very good benefits. And if it produces very good benefits in someone who's scheduled for bypass or someone who's scheduled for, a wound care or something like that, then that's not good for the hospital.
Can you tell our viewers what else you do? What other kinds of illnesses that people come to see you, and what you treat at your wellness center?
Well, most of our patients have a form or variation of heart disease and diabetes. That's our patient load. We do see cancer. Now, in cancer, I wrote about Dr. Brzezinski down in Houston. I've been down there several times. I am convinced that Dr. Brzezinski has discovered the breakthrough for cancer. Mm-hmm. His little antineoplastons regulate the division timing of cancer cells. Glioblastoma, it will divide every 12 days, so to speak. You know, but the normal cells in the brain, they divide every 70 days. So you can see that when the cancer cell is dividing much more rapidly, it's going to grow. It's going to invade, it's going to infiltrate, it's going to metastasize. When they take in the antineoplastons, which are little peptides that he discovered over in Poland, it regulates this undisciplined cell division. That's good for all cancer. You know, prostate, you know, lung, liver, because when you regulate that, then cancer does not proliferate. So, but they will not let him alone. Mm-hmm. They know that if he is free to propagate and utilize his therapy, cancer surgery, chemotherapy, and radiation therapy are gone. Because we are now seeing this continual increase in cancer, even though we're doing all those therapies. So I'm very discouraged that it's done in several foreign countries, and I've been telling Dr. Brzezinski for a long time, he's got to get out of this country. He cannot, they'll never. I have a newsletter, and back in the 90s, they were about to put Brzezinski in jail. Mm-hmm. And so I wrote in the newsletter about his plight, give some money to him. I had no input from that. And I raised $70,000 for Brzezinski. And it helped him pay his legal bills. And it also, we also sent a lot of patients to him. But the FDA and the National Cancer Institute and all that kind of stuff, they hate him. And they've already essentially put him out of business because he can't use the anti-neoplastones. Mm-hmm. It's evil.
Right. We had him on our show. It had to be about a month or two ago. And the funny thing is, right after we had him on the show, about a week later, they gave him permission to start his third trials, clinical trials that he was waiting for a while. So we're really happy about that.
How about this? He was waiting for decades.
Mm-hmm. Yeah, and thank God, they gave him permission to start that. So hopefully, and we had a long conversation. If anybody out there, it's on YouTube now with Dr. Brzezinski and the Health Show. And he's come a long way, and it's been a big fight. But he's like I am, persistent, and he goes forward, and he's doing good by people. He really is, and he's helping people. So is there anything that we didn't cover that you would like to talk about before we end?
I don't think so. I think this was fun. I covered a lot of things that are close to my heart, a lot of things that we use with our patients now. So I'm happy.
Okay, good. Now, if someone wanted to get in touch with you, how would they go about doing that?
Well, our phone number, we have an 800 phone number, but I don't have it with me. But our regular phone number is 949-851.
I think I have it here. I think I have it here somewhere.
Good, yeah.
Let me see. It's 800-488-1500. Is that right?
That sounds like a plan.
Yeah. Okay, and your website?
Is WhitakerWellness.com.
Okay, and you have a number of books out there on Amazon, I would imagine, right?
Yeah, I have reversing heart disease, reversing diabetes, what you need to know about bypass surgery, reversing hypertension, reversing weight loss. I have called the mini fast diet, where you just don't eat breakfast and exercise. There's a lot of information. A lot of that we have connections to from our website. Mm-hmm. And also drwhitaker.com is, I'm the spokesman for an outreach for vitamins. There's a lot of high potency vitamins that we advocate, and that's through drwhitaker.com.
Oh, that's great. That's great. So I want to thank you very much. It's been an honor to have you on our show.
Oh, my pleasure. I'd love to see you again.
Thank you. Thank you. Have a good day.
Thanks,
so there
sir.
you have it. Dr. Whitaker, another doctor that has a wealth of information. And go to his website, look at his books. They're on Amazon. And I hope you enjoyed the show. And we'll look forward to seeing you again the next time. Thank you.